So hi guys! So this is Mr. Leo Malde Guzman again. Pararas, bubumbara, let's go! Sasabay ka ba? Sasabay! So guys, I'm sorry if I made a late video regarding this topic and regarding this YouTube channel I'll be making. So medyo na busy lang guys. So ngayon, I'm having this lecture, actually this video regarding the ratio of our topic for today, which is cardiovascular. Okay? So I'm focusing guys most likely on a procedure. So I'm sorry again, and right now I'm in top rank Nagupan. So guys, let's have this video and I hope this would help you in terms of your preparation for the board exam and also for NCLEX. So therefore guys, let's start. Our question is SATA. Favorite nyo to guys. Malapit sa word na satanas. Mahirap siya. Let's try to answer. Let's start. Now, therefore guys, our topic would be treadmill stress test. So which of the following nursing management is important for a patient about to undergo treadmill stress test? So first and foremost guys, what is treadmill stress test? Treadmill stress test guys is a procedure wherein we want to determine the capacity of the heart of the patient in terms of comparing it to activity level and also in comparison with rest. So this test is to determine and also for the doctor to know what is the best activity restriction and what is the best activity level that is the patient capable of doing so that we could avoid stressing the heart. We know guys that if we perform excessive exercise, we could overwork the heart and that could lead to myocardial ischemia. If there's myocardial ischemia, therefore guys, that can also lead to anaerobic respiration leading to lactic acid formation and ultimately guys, myocardial injury leading to myocardial necrosis and myocardial infarction. Therefore guys, we need to avoid overstressing the client in terms of activity because it could cause detrimental effects to the client. So therefore guys, how would we know that what is the best activity level for the patient? Therefore guys, the best test goes to your treadmill stress test. So let's try to understand. Okay, what is the significant nursing management for a patient about to go treadmill stress test? Okay, so what is your nursing considerations for this one? Therefore guys, it's a treadmill stress test. The patient will run in a treadmill guys, and we will determine while the patient is having a treadmill stress test, there are ECG leads on the chest of the client to determine how the heart reacts. So therefore guys, this determines if the patient can tolerate activity. So what are the significant considerations for this test and what is the significant nursing management, and we'll try to check. This is select all that apply. Therefore guys, instruct the patient to ask medical doctor if metoprolol would be taken. Therefore guys, metoprolol, we know that metoprolol is a beta blocker. Therefore guys, what would it do? The beta blocker guys blocks the beta adrenergic receptors. The beta adrenergic receptors guys stimulates sympathetic responses. Therefore guys, if the beta blocker blocks the sympa, what's the effect? The heart rate, RR, BP, and the functioning of the heart would be affected. Therefore, metoprolol affects the activity of your heart. Therefore, if you give this drug to the patient before the test guys, significantly guys, it will affect the functioning of the heart. And if it affects the functioning of the heart guys, we would not be able to determine, or we would not be able to assess the heart objectively and in the purest manner guys. Why? Because most likely guys, we gave metoprolol. So therefore guys, in the simplest manner guys, we cannot give BP drugs, we cannot give cardiac drugs, or we cannot give drugs that can affect the functioning of the heart. Therefore, can metoprolol affect the functioning of the heart? Yes. But guys, we don't need to ask the doctor if the metoprolol will be taken. We as nurses should be knowledgeable that metoprolol would not be given. Therefore guys, this option is wrong. Why? What made it wrong guys? Because you told the patient to ask the doctor. You don't need to ask the doctor guys. You as a nurse knows that metoprolol should not be given because why? It affects the functioning of your heart. It depresses your heart rate, RR, BP, glucose. Why? Because it blocks the beta adrenergic, which blocks the sympathetic responses. Therefore, the drug would affect the test. But this is wrong guys because you asked the doctor. The drug is not given, but you shouldn't ask the doctor because the nurse should be knowledgeable about this manner. Next, number 2. Report to the medical doctor if heart rate is 110. Now, we know guys, the treadmill stress test guys, we would stress the client. We would allow the patient to run on the treadmill. Therefore guys, if we know that the patient would run in a treadmill guys, is heart rate elevated? Is heart rate expected to increase? Yes, heart rate is expected to increase. Therefore guys, this is expected. What will increase? Heart rate, RR, BP. Is that expected to increase? Yes, of course. Why is it expected to increase? Because most likely we have activity level. And if we have activity level, guys, it's significantly important to know that the heart rate RRBP will be increased, and that's expected. So therefore, guys, you don't need to report it. Why would you need to report it if it's expected? Therefore, guys, this option is also wrong. Next, number 3. Continue the test if there's chest pain of a level of 1/10 level. Guys, chest pain, even though it's 1 out of 10, chest pain is present. Therefore, guys, if there's significant chest pain, this is one of the criteria for the doctor to stop the test. Why? If there's chest pain, therefore, there is difficulty of the heart. There is aerobic or anaerobic respiration. And chest pain is a sign that there is problem in your perfusion status of the heart. Meaning, there is a problem in the oxygenation of the heart. Chest pain is a sign that there is myocardial ischemia. And if there's myocardial ischemia, guys, therefore, can we know that is the patient tolerating the activity? Yes or no? No. The patient is not tolerating the activity, guys. Why? Because of the evidence of the chest pain. Therefore, guys, we cannot continue the test if there's chest pain, even though it's only 1 out of 10. Any level of pain, of chest pain, during the test, significantly tells you that you need to stop the test. Therefore, continue is wrong. Continue is wrong, guys, because you don't need to continue. Rather, you should stop the test because there's chest pain. And if there's chest pain, it means that the heart has difficulty in functioning with respect to the treadmill stress test or with this significantly related to the activity level. Therefore, guys, this option is also wrong. Next, number 4. Instruct the patient to take a light snack of chocolate bar. Guys, before the test, the patient can take a light snack. That's correct. No problem. You can give a light snack before the test. Why? Because we want to prevent significant findings that can cause hypoglycemia. And if there's hypoglycemia, that can cause problems during the test. The light snack is correct. But the chocolate bar, guys, is wrong. Why is it the chocolate bar wrong? Because chocolate bar, guys, contains significant caffeine. And we know that caffeine could affect the functioning of the heart. It could cause increased heart rate, RR, and most likely, guys, the caffeine would stimulate the heart. Therefore, if the heart is stimulated, we cannot assess if the heart is functioning well or if the heart is affected because of the activity or because of the caffeine. So in the simplest manner, guys, caffeine is not allowed before the test. Why? It affects the heart. Smoking is not allowed before the test. Why? It affects the heart. We should have a great sleep before the test. Why? Because it affects the heart. Metoprolol, going back, is not allowed because it affects the heart. In the simplest manner, anything that affects the heart would not be allowed. Example, smoking. Example, caffeine. It affects the heart. Sleep affects your heart. BP drugs, cardiac drugs affects your heart. If your crush is there and it will stimulate you to have tachycardia because your crush is there. Therefore, your crush is not allowed to be there during the test. But I'm kidding. So seriously speaking, smoking is not allowed. Caffeine is not allowed. So that means coffee, tea, energy drinks, or chocolate is not allowed. BP drugs is not allowed, and proper sleep is needed. So therefore, the patient should sleep prior to the test. So again, number 4, light snack is correct, but the chocolate bar is wrong because of the caffeine, which affects your heart functioning. Therefore, this option is also wrong. Next, stop the test if the AUTOSAR is down to 90%. We know what's the normal AUTOSAR. The normal AUTOSAR, guys, is 95 to 100%. Therefore, guys, the AUTOSAR is down to 90%, which means it's below the normal levels. But we know, guys, that activity can affect your AUTOSAR. Can it affect your AUTOSAR? Yes, because you're consuming oxygen during activity. Therefore, if your oxygen is decreased during the test, is it expected or unexpected? It's expected because you're using oxygen during the activity, which is the treadmill stress test. Therefore, AUTOSAR 90% is expected. It's acceptable. Therefore, guys, you don't need to stop the test. Remember, you only stop the test if there's significant chest pain, dizziness, or severe hypertension or hypotension during the test. Therefore, just like for number 2, heart rate is elevated, that's expected. For RR, elevated, that's expected. BP elevations, slight elevations is also expected. AUTOSAT down to 90% is also expected. Therefore, guys, you don't need to stop the test because those findings are also expected. Therefore, guys, this option is wrong again. Therefore, guys, this is select all the apply. We have a last option to determine. So, therefore, in select all that apply, guys, we can have a lot of answers. We have a lot of options. We can also have one answer or we can have no answer. So, the NCBSN already changed the mechanism of the SATA. You can have a SATA with multiple answers, 2, 3, 4, 5, anything goes. You can have a SATA wherein there's no answer, or we can have a SATA wherein there's one answer. So, therefore, it makes the NCLEX really hard and the SATA question even harder. Next, tell the patient that the test is to check the size of the heart. Remember, guys, what are we checking the treadmill stress test? We're checking for the activity level and also the response of the heart with respect to the activity level of the patient during rest or during activity. Therefore, guys, we're checking for the capacity of the heart. We're not checking for the size of the heart. We're checking for the capacity of the heart. Therefore, guys, what checks the capacity of the heart? The capacity of the heart is checked by the stress test with respect to activity and rest. So therefore, guys, the stress test checks the heart functioning and capacity. While on the other hand, the size of the heart is not checked by the treadmill stress test, but rather it's checked by your 2D echo. Therefore, guys, this option is also wrong. So guys, looking back, guys, if you would check everything, guys, everything is wrong. It's a select all that apply. So it's first time you encounter this question. Everything is wrong. Therefore, guys, in order to answer this question correctly, you need to press next for this question and don't choose any option because everything is wrong. So guys, thank you very much, guys, for watching this video. I hope you like, share, and subscribe. Please support this YouTube channel, guys, so that we could also share this information to other people taking the NCLEX. And thank you very much for everyone that already subscribed and also like my videos. Thank you very much, guys, and have a great day. See you soon. Bye-bye.